Imagine you hit a milestone you have worked toward for months or maybe even years. You reach a specific health goal, your clothes fit differently, you feel this noticeable surge of energy, and you naturally assume you have finally crossed the finish line.
Right, you feel like the hard part is over.
Exactly. But then, almost imperceptibly, you realize the hardest part is actually just beginning. Because the body, acting completely on its own, quietly rewrites its internal rules to push you right back to where you started. I mean, it is arguably the most frustrating phase of any physical transformation, that whole after phase.
It really is. It can be incredibly demoralizing for people.
Definitely. Well, welcome to TalkKast. Today we are looking into a surprisingly complex question about all of this. We are exploring whether a simple weighted vest can actually trick your biology into keeping weight off. Our goal here is to understand the hidden communication network between your skeleton, your metabolism, and your fat cells. If you have ever lost weight only to watch it mysteriously creep back on, this discussion is going to shed a lot of light on what is actually happening beneath the surface.
I mean, that invisible pushback you just described is the exact mechanism that makes long-term weight maintenance so incredibly difficult. And to probe that mechanism, researchers have turned to a remarkably low-tech piece of equipment.
Right, the weighted vest. Because most people just look at a weighted vest and assume it is simply a brute force tool to make walking harder.
And, well, functionally, it certainly achieves that. If you take a walk at a comfortable pace wearing a vest that equals about 15% of your body weight, you are going to burn roughly 12% more energy than you would without it.
Which is pretty significant.
Absolutely. And if you add a moderate incline to that walk, perhaps a 5 to 10% grade, you hit what exercise physiologists consider a calorie-burning sweet spot. It feels completely doable, but your legs are forced to work harder, your cardiovascular system engages more deeply, and your overall energy expenditure goes up by about 13%. It is, a very straightforward way to increase the mechanical demand on your body without resorting to running or high-impact plyometrics.
Sure, the immediate calorie burn is interesting, but that is essentially just physics, right? Moving more mass requires more energy. But that is not the most compelling part of this topic, is it? The real question is whether adding this kind of external load can actually alter that frustrating after phase of weight loss we were talking about. We're looking at whether wearing a vest changes how the body biologically regulates itself over the long term.
That is the core of the whole concept. To understand why a piece of canvas filled with iron sand might matter on a deep biological level, we have to unpack why maintaining weight loss is so notoriously difficult. It ultimately comes down to two compounding biological issues that basically create a trap for anyone who has recently lost a significant amount of weight.
Okay, so what is the first issue?
The first one involves your resting metabolic rate. This is the background energy your body uses just to run its basic operations: breathing, circulating blood, cellular repair, and baseline brain activity. Naturally, when you inhabit a smaller body, it requires slightly less energy to run.
Right, that is just simple math.
Exactly. However, clinical data shows a secondary, much more aggressive pattern. Following weight loss, the resting metabolic rate drops far more than we would expect just from the reduction in body mass.
Wait, so if someone loses 20 pounds, their metabolism does not just adjust to being a 20-pound lighter person?
Not at all. The body actively pulls back on the throttle even further, almost as if it is bracing for a famine. This phenomenon is known as metabolic adaptation. The body recognizes that it has lost a significant energy reserve, which is what fat is, and it essentially attempts to spare energy by becoming hyper-efficient.
That sounds incredibly frustrating.
It is, and the toughest part for anyone dealing with this is that this signal can stubbornly persist for years. Even people who successfully keep the weight off for a long time still show measurable signs of this metabolic slowing. The body holds on to every calorie it can, basically refusing to accept the new, lower weight as the baseline.
Wow. And you mentioned a second issue.
Right. The second issue operates right alongside the first. Your appetite signals get significantly louder. We are not talking about a lack of psychological willpower here. We are talking about a measurable biochemical shift. Hormones like ghrelin, which drive the physical sensation of hunger, actually increase in circulation. Meanwhile, the satiety hormones that tell you when you are full decrease.
So you are just hungrier all the time.
Precisely. People dealing with this often describe it as a biological background noise that suddenly gets turned up to maximum volume. Food becomes more distracting, cravings feel much sharper, and what used to be a completely normal portion just stops feeling adequate.
So let me try to put a mental model to this. It is like You have been carrying a moderately heavy backpack everywhere you go for years. You wear it to the store, you wear it to work, you wear it all around the house.
I like that analogy.
Right. And then one day you finally take it off. At first, your shoulders just feel this incredible immediate relief. But your brain had quietly been using the physical heaviness of that backpack as well as a baseline calibration tool. It used that persistent load to calculate exactly how much food you need to eat, how much energy you should be burning at rest, and how sturdy your structure needs to be. Intentional weight loss is essentially removing that internal backpack. The physical relief is real, but the body's calibration layer goes into shock, starts nudging you biochemically to put the backpack back on.
The backpack analogy captures the systemic panic perfectly, though it is important to realize the body does not conceptualize it as a backpack. It conceptualizes it as survival. It orchestrates a highly coordinated biological response to restore its previous state. It lowers the energy output and raises the desire for fuel input. And this is exactly where the weighted vest enters the picture.
It replaces the backpack.
Exactly. If the body is aggressively sensing a missing load, the logical question is, what happens if we re-add some of that missing load externally?
Which forces us to ask a rather bizarre question. I mean, if the body is sensing a missing backpack, how exactly does it know the load is gone? What internal scale is weighing us? We know the brain regulates hunger and the stomach sends fullness signals, but they don't possess a physical scale.
That specific question leads us to one of the most unusual biological mechanisms out there, the gravitostat hypothesis. When we think about body weight regulation, we almost exclusively focus on the brain, the gut microbiome, and fat tissue.
Right, the usual suspects.
Exactly. But the gravitostat hypothesis proposes that there is a dedicated weight sensing system located primarily in the lower extremity, weight-bearing bones of the body.
Wait, our bones?
The mechanism basically works like this. Specific bone cells act as mechanical sensors. Because they are the foundational structure of the body, they constantly detect the physical compressive load of your body pressing down on them through gravity. When you lose weight, that mechanical load drops. The compression changes. So these bone cells detect that subtle absence of downward force and send a systemic signal throughout the body. That signal alerts the brain and the metabolic system that mass has been lost, which then triggers the appetite increase and the metabolic slowdown to restore the fat stores.
I have to pause you right there because this challenges practically everything we learn in basic biology. Our bones are generally presented as inert structural scaffolding. You're saying they're actively communicating with our fat cells and our metabolism.
I know, it sounds radical because we are conditioned to view the skeleton as a passive frame. But bones are highly dynamic, living tissues. They are constantly remodeling themselves. While the human evidence is still developing, the mechanistic nuance we see in animal models is incredibly robust.
How so?
Well, researchers have used mice with actual physical weights implanted into their bodies to observe the biological response to sustained increased loading. They discovered that when the physical load increases, there are specific mechanosensing pathways in bone lineage cells that activate. Think of it like a pressure switch.
Okay, so the bone actually feels the pressure.
Precisely. When the bone cell is compressed, it alters its internal fluid dynamics and cellular shape, which triggers the release of biochemical signals. These bone cells work alongside localized nerve signaling pathways to regulate fat mass. So the overarching hypothesis being tested in humans is that by putting a weighted vest on a person who has recently lost weight, we are artificially replacing the missing mechanical load.
Tricking the body, basically.
Exactly. The goal is to trick those lower extremity bone cells into registering the physical compression they are used to. If they feel the weight, they will not send the systemic alarm bells that slow down metabolism and ramp up hunger.
So that reframes the vest entirely. It moves from being just a piece of workout gear to an actual biological intervention device. But I mean, moving from mice with surgically implanted weights to human beings is a massive leap. When they actually put these vests on people to test this gravitostat theory, what does the data show?
The clinical trials provide a very nuanced reality check. Let's look at a recent randomized proof-of-concept trial. Researchers took adults with mild obesity and assigned them to wear either a heavy vest, which was calibrated to about 11% of their individual body weight, or a very light placebo vest.
And the light vest was just to control for the psychological effect of wearing it.
Exactly. It was only 1% of their body weight, so it provided no meaningful mechanical load. Participants wore these vests for 8 hours a day for 3 weeks.
Wow, 8 hours a day.
It is a lot. But the results were fascinating. After just 3 weeks, the high-load group retained their muscle mass while losing significantly more fat mass than the light vest group. Now, in terms of absolute pounds lost, the results were modest, which makes sense given that 3 weeks is a very short physiological window.
Right.
But the mechanistic implication was massive. It strongly suggested that the extra physical loading was directly involved in internal body weight regulation rather than just burning a few extra calories from the physical effort of carrying the canvas vest around.
That is wild.
We also have data from a longer pilot program observing older adults living with both obesity and knee osteoarthritis. These participants went through a highly structured, calorie-restricted diet over several months. A portion of them were assigned to wear a weighted vest during the weight loss phase and for a maintenance period afterward. The group wearing the vests saw their resting metabolic rate drop significantly less than the diet-only group.
So it actually protected their metabolism.
It did. And even more compelling, when researchers followed up with these individuals 2 years later, the vest-wearing group had regained noticeably less weight.
This perfectly aligns with what we touched on in Why You're Not Losing Weight, specifically regarding how aggressively the body defends its biological baseline. By providing the mechanical pressure the body expects, the vest seems to prevent the defense mechanisms from ever fully deploying.
That is exactly the theory.
But if you were listening to this right now and thinking about buying a 20-pound vest to wear around your house all day, we really need to talk about the practicality. Because wearing a heavy vest for 8 hours every single day sounds absolutely exhausting. I imagine your shoulders would ache, your posture might suffer, and you would probably just want to sit down. Did anyone track whether the people in these trials actually just burned more calories by fidgeting under the weight, or if the vest changed their behavior in negative ways?
That is the exact behavioral trade-off we have to examine. In another recent trial, this one lasting 5 weeks, researchers looked very closely at behavioral changes. They tracked the participants' movements meticulously. And your skepticism is totally validated by the data. The researchers found that sedentary time actually increased in the high-load group.
So they were just tired.
Quite literally. The people wearing the heavy vests spent more time sitting down, highly likely because the continuous load made them physically fatigued. Furthermore, their overall measured energy expenditure and their daily energy intake did not clearly change compared to the control group.
But wait, their body composition still improved.
It did. Despite sitting more and eating roughly the same amount, they reduced fat mass and waist circumference while increasing lean mass.
That is incredible.
It is the strongest piece of evidence pointing toward the internal, gravitostat-driven biological regulation. It proves the intervention worked even when the sheer physical fatigue caused them to move less. However, we cannot simply gloss over the physical toll it took.
Right, the side effects.
Exactly. Side effects like musculoskeletal complaints, which included joint pain, muscle soreness, and localized swelling, were noticeably higher in the heavy vest group. The participants even reported a higher incidence of respiratory tract infections.
Really? From a vest?
Possibly due to the minor restrictive effect the vest has on the chest cavity over 8 hours, or just general systemic fatigue. It is definitively not a consequence-free intervention.
That brings us to a major point of confusion. I see a lot in the broader fitness community, and something we definitely need to clarify. Because we are talking about bone-sensing weight, it naturally leads people to assume that a weighted vest is the ultimate tool for building bone density. I see this claim everywhere online. People strap on a vest and think they are bulletproofing their skeleton against osteoporosis. We need to untangle this because bone signaling and bone density are not the same thing at all.
They are completely distinct physiological processes, and you are right that the internet frequently merges them into one overly optimistic, inaccurate claim. The idea that simply walking around with a vest is a shortcut to building bone density is a widespread misunderstanding of biomechanics.
So how does bone density actually increase then?
To stimulate meaningful structural bone growth and increase physical bone density, your skeleton requires high-magnitude dynamic compressive forces. Think about the sharp impact forces of jumping, or the massive skeletal load required during heavy resistance training, like performing a heavy barbell squat or a deadlift. Walking, even with a 15-pound vest, simply does not create the necessary force profile or the rapid rate of loading required to trigger the osteoblasts to form new bone tissue.
So it just isn't heavy or fast enough.
Exactly. And we have hard clinical data to back this up. In a large 12-month clinical trial observing older adults going through a weight loss program, participants wore weighted vests for around 8 hours a day, specifically to replace the physical weight they had lost. Despite this incredibly intensive daily vest use, it completely failed to prevent hip bone density loss over that year.
So it did not protect the hip bone at all.
Not at all. The decrease in bone density at the hip was broadly similar across all groups, regardless of whether they wore the heavy vest, a light vest, or no vest at all.
So we have to separate these two concepts entirely. The vest might be a fantastic tool to help your lower extremity bones send a chemical signal to your metabolism, but it is not going to magically cure osteoporosis. And it certainly does not replace the fundamental need for heavy, loaded resistance training if your primary goal is skeletal health.
That distinction is critical. The vest is a communication tool for the gravitostat mechanism. It is not a structural reinforcement tool for the skeleton. Understanding that difference dictates exactly who should actually be using this equipment, and more importantly, how they should be using it to avoid injury.
Given the potential metabolic benefits we have discussed, combined with the very clear physical risks like the joint pain and swelling you mentioned earlier, how should a person actually use a weighted vest intelligently? It seems like treating it as an all-day accessory where you just throw it on and go about your normal life could backfire.
It absolutely can backfire, and the clinical consensus is clear about the physical risks. The most effective way to view the weighted vest is as a precise dosage tool, not an endurance contest. You are adding external resistance to your frame. That makes everyday body weight movements, like doing step-ups, lunging, or even just carrying laundry up a flight of stairs, inherently more demanding on the muscular system. But we have to remember gravity. Every single pound you add to your torso adds stress downward through the spinal column into the hip joints, down to the menisci in the knees, and all the way to the connective tissues in your feet.
It sounds a lot like the foundational concept of progressive overload in strength training. I mean, if you are listening to this and you have never worn a vest, you shouldn't jump into wearing a 20-pound load for a 10-hour day, any more than you would walk into a gym and try to squat your absolute maximum weight on day one. Your tendons, ligaments, and joints need time to adapt to the new force demands.
That is a highly accurate comparison. The established safety guidelines in exercise science recommend starting very light. You should begin with a vest that equals roughly 5% of your body weight and progress incredibly slowly. Over time, depending on your individual fitness level and joint health, you might work up to 10 or 15% of your body weight for dedicated exercise sessions, but patience is absolutely vital.
Are there people who just shouldn't use them at all?
Definitely. We have to be very clear about contraindications. If you have existing conditions like osteoarthritis in your knees or hips or chronic obstructive pulmonary disease, adding a weighted vest is generally considered inappropriate and risky.
That makes total sense.
But perhaps the most hidden and severe risk involves the spine. When you load the upper torso with a vest, any movement where you bend forward or twist at the waist becomes exponentially more dangerous. Think about the biomechanics of daily tasks. Leaning forward to load the bottom rack of the dishwasher, bending down to pull a weed in the garden, or twisting to grab a heavy bag of groceries from the backseat of a car.
Right, everyday movements.
Precisely. When you execute those movements while bearing an external torso load, you significantly increase the shear forces on the lumbar vertebrae. For anyone who already has a heightened risk of osteoporosis or existing spinal issues, this drastically raises the risk of a severe spine fracture.
So integrating it into your life by just wearing it blindly from morning until night, twisting and bending naturally as you go about your day, is actually putting your spine in a highly vulnerable position.
Exactly. The safest, most evidence-consistent way to utilize a weighted vest right now is as a targeted tool during dedicated exercise routines or focused walks. During those specific sessions, you can ensure you maintain strict upright posture, keeping the spine neutrally aligned, rather than subjecting it to the unpredictable shear forces of daily chores.
That is great advice. So to sort of synthesize all of this, weighted vests represent a genuinely intriguing tool to probe our body's deep metabolic regulation. The early data suggesting they can help resist the profound metabolic slowdown and the severe appetite spikes that inevitably follow weight loss is incredibly exciting.
It really changes how we look at the weight management process.
It does. It shows us that weight management is not just a psychological battle of sheer willpower. It is about navigating deep evolutionary biological pathways. However, a vest is not a magic switch. It does not replace the fundamental pillars of health. You still require high-quality sleep, a nutrient-dense diet, and structured progressive exercise.
Absolutely. It is an adjunct tool, not a replacement for the basics.
That is a brilliant reminder that our bodies are highly sensitive, highly adaptive environments. They are constantly reading the room, or in the case of the gravitostat, literally reading the physical load and adjusting internal levers to keep us safe and preserve energy.
They are just trying to protect us, ultimately.
Which leaves us with a fascinating, broader question to think about. I mean, if our lower extremity bones are constantly calculating the physical weight of our movement to regulate our metabolic baseline, how might our increasingly sedentary, zero-resistance modern lifestyles be fundamentally changing our biology? If we spend most of our days sitting in supportive chairs, removing that natural mechanical load from our skeletons, we might be inadvertently sending our metabolism a continuous signal to slow down and store energy. It is definitely something to ponder the next time you sit down for a long stretch. Thanks for listening to TalkKast.